And start recording.
You're all set?
Thanks. Well, good afternoon, Mayor Pro Tem, and Council. We're here again to provide an update on COVID-19 in Broomfield. I'm Jason Bolling, Director of Public Health at Deb Fetterspill, our Deputy Director, and Sarah Mock, who oversees our health planning, data, and communications. We'll go to the next slide. So as we always start out with and show from the previous week to this week, we had an additional 105 cases, one additional hospitalization, and 0 deaths. Next slide. One thing that I shared with you prior to this meeting via email, but we'll be announcing to the public, is Broomfield will be moving to level yellow. And this is based on the fact that our case incidence rate has been in the yellow level for over a 7-day period, and that's what triggers the move. Additionally, CDPHE has created a buffer zone of 15% above these thresholds, but unfortunately, we have exceeded that even for the 5-day period that they've established. So we are seeing, obviously, cases going up. Our percent positivity is again slightly increasing, but still below that 5%. And then we still remain with 10 days of declining or stable hospitalizations. Next slide. So as far as some of what's happening statewide, cases are plateauing and hospitalizations or deaths are declining. There's now 190 confirmed cases of the B117 variant of concern, and also 88 cases of the B1427 variant. You'll recall, and I know we're trying to avoid using geographic locations, the B117 is the UK variant, referred to that often. The B1427 is the California variant. And then, as was announced today from CDPHE, there are 3 cases of the B1351 South African variant detected in Colorado, and it's been detected in 20 other states. We'll continue to track this. CDC had been modeling that by middle to late March, the UK variant could become the predominant strain. We're still tracking to see if that will be the case. It's not the case in Colorado right now, but it is going up significantly. And again, with these variants, as they spread in Colorado, we could see another peak in hospital demand. So high levels of transmission control, vaccine distribution, and vaccine uptake are what we're really emphasizing on right now to strengthen the community's level of protection. Next slide. As far as Broomfield, this just illustrates where we are as far as cases and why we did move to level yellow. Level yellow. What you can see is it usually takes about 2 weeks after you make a move in capacity limits when you start to see the impact. And what we're seeing right now is a sustained increase or elevated increase in our epi cases or the epi trend. We'll see if that continues or if it starts to level off or decline. Next slide. So the obvious questions are, why are cases increasing in Broomfield? One is the variant is prevalent in the state, as we talked about before, and we know that our surveillance is likely not catching all of the variant cases due to the capacity of our lab systems, not the state lab, but some of the other labs that the state works with. And they're trying to work to increase that surveillance capacity. Another potential contributing factor to that is increasing capacity across sectors. And then lastly, personal behaviors. We know how this comes into it. And so we're seeing currently 53% social distancing compared to 92% in April of 2020. And if we went back to December, we had very high levels of people that were staying at home. So we're just seeing more mobility in general. And then, as I mentioned before with the variant, we do have 9 variant cases in Broomfield that are the B117. We have 1 of the B1427, and then we have 4 outbreaks right now in Broomfield. 1 in a school, 2 high school sport teams, 1 child care center, and then we have 1 additional pending outbreak. Next slide. So this just gives you a better sense of where we're seeing that elevated incidence growth, and it's happening in Broomfield, Denver, Douglas counties, along with Weld in the Northeast. Our hope is to have that plateau and start to decline as we put out more messaging to the public on following the 4 Ws. Next slide. So what does it mean to move to level yellow for Broomfield? We've been in this level before, so I'm sure a lot of our businesses and our partners are aware of this. A couple of key things is the back to business certified businesses can continue to operate in level blue. And Jeff Romine has brought this up a couple times as that being one of the benefits of being in the back to business program. All other businesses, though, will be operating in level yellow. And while most sectors will still operate at 50% capacity, the number of people permitted per room for the activity for restaurants, gyms, organized sports and events will be reduced back to the level yellow limits. And what does it mean for our facilities? The rec facilities will continue to operate under level blue. Capacity limits are a back to business certified business. And then the Broomfield Library Auditorium and Depot and Veterans Memorial Museum will continue to operate at 50% capacity. Next slide. A couple other things happening on the vaccine front, both at the state and local level. The 1B3 phase started on Friday last week, and we've seen people already enrolling and getting their vaccines. Johnson & Johnson arrived in the state and is already being administered. The state is scaling up for large clinics, as we mentioned last week, also scaling up their equity clinics, and then looking at local large clinics to handle the increased supply we're expecting in vaccine to come in late March and early April. And that's in addition to the existing channels of distribution they have. As far as the local level, we're scaling up in response to the increased vaccine allocations. So continuing what we're doing in that gap filling role, but also identifying other partners such as Thornton Fire, who already has the capacity in place for us to partner with to provide vaccines to Broomfield residents. The other thing is we're planning for a large scale event if we need to ever stand it up at the First Bank Center. Excuse me, and we estimate that we could run through or vaccinate 1,000 people in one single day. And so if you think about running it over a weekend, we could hit 2,000 people if we need to go that route with the First Bank Center. And we've already started those discussions. And then lastly, around vaccine hesitancy, we have a vaccine ambassador program that we've started up where we're partnering with community-based organizations and having them be the primary messengers in the community to share some of the key information and lessons learned around the vaccine to help those individuals in the affected communities overcome some of the barriers to get the vaccine. Next slide. So this just shows where we're at as far as the vaccine distribution. And as I mentioned, we're in 1B3 right now. And again, that's people age 60 or older, frontline essential workers and grocery and agricultural, and then people age 16 to 69 with 2 or more comorbidities. And you can see those defined below. We're estimating that we'll be moving to 1B4 on March 21st based on the vaccine supply. And this would include those 50 and older frontline essential workers, people with high-risk conditions, again, those comorbidities, and then the continuity of operations for state and local government. That's basically keeping our government functioning. Next slide. So we continue to do an amazing job in Broomfield of vaccinating our residents, and our residents are doing a great job of actually going out and receiving their vaccines. So you can see that 87% of our Broomfield 70 plus have received at least 1 dose of the vaccine. And you can see the vast majority of them have received their 2nd dose. The 65 to 69-year-olds, we've seen 90.5 that have received at least 1 dose. And not to be expected, where most of those have received just 1 vaccine at this point. And so we'll be working on the 2nd vaccine as their time comes up. And we're starting to move to that 60 to 64 age group and really emphasizing our efforts there. Next slide. I thought this slide helps a little bit just to show how well Broomfield's doing. It's a little bit hard to read, but this is looking at COVID vaccination rates per 1,000 persons in the Denver metro region. And the dark red is actually good. So what you can see is we're doing an extremely well job in Boulder and Broomfield, Douglas counties, and some other areas, but we do have vaccine deserts that are coming up, and specifically when you look at South Thornton, South Westminster, Commerce City, and North Denver as areas where we may need to place more energy and emphasis, both from a state and at a metro level. Next slide. And we always have updated information on our website and our weekly scorecard. And with that, I'll turn it over to questions. And I think before I do that, Sarah wanted to just briefly get your input on our weekly scorecard and see if that's something that's useful to council now that we have a lot of that information up on our website. So Sarah, you want to take it from here?
Sure. I just wanted to see if that was still a useful tool for understanding where we are on the different metrics that are out there and the narrative portion of it where we give just a little bit more detail. I know we're having these conversations, so I just wanted to check in if that's still something that you guys benefit from. And it's okay to say no.
I was going to say for our benefit, so we can answer questions, if you just feel like emailing myself or Deb, that's fine with us, and just let us know your preference going forward.
So would you put up exactly what you call the weekly scorecard?
Absolutely.
Just so we can know what we're trying to like or not like?
Sorry, Mary, I gotta get it up there for you. I think I'm presenting the scorecard. Deb, can I get you to, yeah, okay. So I'm sorry, this is one that's just a week out of date because that's the link that was there. I'm sorry, it's not out of date, but so we just give you that narrative about what's been happening in these different epi trends in hospital testing, vaccine enforcement. And then the second page is where we are on the dial metrics for this current level, excluding protect our neighbor. And we'd originally developed this to see, are we anywhere close to getting to protect our neighbor? And then obviously we've added the other pieces of the dial framework as we've gone along. So the following pages are really about those metrics specific to the protect our neighbor level, which it was helpful when we were a little bit closer there the other week, but I'm not sure if it's still relevant. And then we try to keep this as the current week and the previous week's data updates around what the metrics are and what has been happening with the trends. So it's 2 weeks worth of information in one document. Does that help, Mayor?
Yeah, tremendously. Okay. Yeah, and I don't use that, so.
That's why we wanted to ask. So if it's not proving useful as a tool for you guys to keep up to date, it's okay for us to drop this, but our team is also fine with continuing it. We're in the habit of it at this point.
So as I mentioned before, if you have thoughts on this, feel free to email Deb and myself, and we'll take it from there. So I think we're ready for questions. And I see Councilmember Groom has a hand up.
Sure, thanks. Yeah, I guess for me, I'm disappointed to see that our numbers are going the wrong direction. Do we know any more? I mean, on why? I know that we before I've tried to say household exchange is 30% of our cases, or it's people eating at restaurants, or like where is the source coming? And I know you had said it was some regional movement. Like, how is there still any way at all to put some statistics behind any of that? And I know Deb is kind of shaking her head or nodding her head, so I'm not quite sure where we're at on any of that statistics.
Yeah, Deb, since you work most closely with our EPI team, you want to take that?
Sure. So we actually just ran the exposure data, and certainly we can send this as a follow-up email because you don't have it in front of you. But for looking at cases just for the past month, where we have seen this upward trend, and as you mentioned, Councilmember Groom, household transmission continues to be a large source. It's about 33% of our cases were affected by a household member that contracted COVID and spread it. We've got about 11% related back to sports. A little over 6% are individuals who traveled recently, mostly domestic travel or even just to the mountains. We've got a little over 6% are social gatherings, about 4% are work-related exposures, and then we have that large category, which I know is frustrating, but it's the 30 4.5% of our cases are that what we call community transmission. And it's where individuals aren't able to pinpoint a direct exposure related to those other categories that I mentioned, but we attribute it to people just being out and more active in the community and having high levels of transmission. So that's the data for the past month, if that helps.
Okay, thanks. And then, I just had another question, darn it, and I didn't write it down.
I could come
Darn
back
it.
to you.
Well, anyway,
I'll come
I'll
back
have
to you if
to
that
email
helps.
you once I think of it. Maybe
Okay.
I'll think of it before tomorrow night. I'm so sorry.
And I can always
Thank you
come
very
back to
much.
you.
That's all I
Councilmember
had.
Grimm. Okay. Councilmember Lim.
So I was looking at the demographics of the increase in cases. So it looked to me like there was a significant increase in the 20 to 29-year-old age group, which would fit possibly the category that Deb just pointed to with community transmission. They're just out and about and don't know where they got it. And, we don't have to look too far to Boulder to see, well, gosh, they weren't, obviously over the weekend, those 20 to 29-year-olds weren't thinking at all about transmission of COVID. So much less some other violence. So, I mean, how do we, they're most likely not entering into the hospital, for as large as the other age groups, but it's still concerning that they are possibly if they're out and about more, they're bringing it home to the household and transmitting it to the older populations. So I guess, if we want to do targeting of messaging, have we thought about that? How to try to reach that age group that, hey, we still can't go and do whatever we want to?
No, it's a great question, Councilmember Lim, and a couple things play into it with that 20 to 29-year-old age group. It's sort of a broad age group. So, some of these are those young adults that either have gone straight to work or they're going to college. And with that, can we do more targeted outreach in both of those settings? So that's one thing definitely we have been considering. So we're looking at the exact same data. Some other data we're seeing within that age group, and then the 30 to 39-year-old age group is some of those that are essential workers. So that really don't have a choice and have to go into the workplace, and the potential exposure that may either be in the workplace or at home. So we're trying to figure out ways that we could do more targeted outreach in that way as well. And so that's something that we'll continue to focus on and get the message out. We are also seeing some increases in our cases. When you look at the demographics, the good news is we're seeing the 70 to 79 and 80 plus begin to stabilize, but our 10 to 19-year-old age group is beginning to start to increase, which is a little bit interesting because some of that started before hybrid. School we started with hybrid, and then also now we're going full in person, but we believe we have limited transmission in schools. So what's occurring outside of the school setting, and again, how can we get the message out through those avenues? And the second thing I would say about that is, you're exactly right. We may be vaccinating our older adult population, which will decrease hospitalizations and deaths, hopefully statewide and in Broomfield. But the problem with not mitigating community transmission, and if you see more and more cases, is it leads for the potential for more spread of the variants. And there's certain variants, again, we're still learning on whether and how more severe they are. And so we want to balance those two as we continue to approach this.
And Jason, I was just going to add, per Council Member Lim's suggestion about targeted efforts towards the 20 to 29 population, Sarah and the communications team has been working on some more targeted messages, having videos, that show like Brouhaha, another event saying, let's get back to these things, working in partnership to get information out through the breweries. And then I think Sarah said also working on some TikTok and social media pushes in the coming days. So that's a good suggestion. And we are trying to get a little bit more focused in some of those messages. So thanks for that.
Okay, thanks. My second comment is to, I guess, question/comment is to say, I'm really happy that we are partnering with Thornton Fire to have those larger vaccination sites. And glad to hear also that we're at least in conversation about having the larger vaccination site at the First Bank Center. Because, that is just amazing. The percentage of 65 to 69-year-olds, we have 91% vaccinated already. That's just amazing. But I think we still have to recognize, I think I'm hearing a lot, from people who are saying it's difficult. The easy part is getting the vaccination. The hard part is getting the appointment in the first place, So it's not without a lot of effort that I think we have to recognize that our citizens are still struggling to get those appointments, and anything we can do to help people get vaccinated is a step in the right direction. So thank you.
Great. Councilmember Anderson.
Thank you. And my first question kind of leads off of what Councilmember Lim just was talking with the rates of the vaccinations. And what struck me was that the 60 to 69 group was actually ahead percentage wise over the 70 plus. And do we have an understanding of how they got up to like 90% so fast, and what we need to do to get to the remaining 70 plus group? Is it the accessibility and the obstacles of the making the appointment, or is it that they don't want it? I'd love to, if we had more information on that, I would love to know.
Can I just make one comment? There is a little bit of a data nuance in there. We opened up to 65 to 69-year-olds, and before we opened up to 60 to 64. So it's a smaller population within that 65 to 69-year-olds, which has helped them increase their percentage of the 65 to 69-year-olds who have gotten vaccinated. So it's a smaller group than the 70 plus, but I just wanted to make that clarification.
And I'll let Deb talk about how our team uses our vaccine interest form with both our partners and in the health systems, as talking about 70 plus, some of the challenges we've heard from other council members and the public about navigating the system. We're doing our best to try and coordinate that on the back end. So Deb, you want to take that one?
Sure. And I think Councilmember Anderson's point is right, that those who could access it thus far have, but we share your concern of are there individuals who haven't been offered the opportunity that we haven't been able to connect with. And so, we did find success through utilization of the vaccine interest form, through a lot of pushes of, just even getting flyers out, like through Meals on Wheels, just going on site into neighborhoods. And I think we attribute a lot of that to our high vaccination rates in the older adults. So now we're really focused on, even as other eligibility groups come online, working, and this is where our community partnerships really come into play to say, are there individuals in the older adult population, for instance, that haven't been offered the vaccine or have barriers to navigating the system, and we need to assist them. And so we do have a process currently where individuals can be added as a call only, and we continue to have new individuals added every week that we contact on the phone. And but another strategy that has been effective is working with our community partners. So for instance, today Sarah and I were on the phone with Pastor Tao with the First Hmong Baptist Church, and where he was sharing that most of his elders don't read or speak in English. And so we're working to get some information into Hmong. And then there's also a Vietnamese group that meets in the church. And so we are coming up with a process for not only to support those individuals for signing up for appointments, but also part of the strategy is working with liaisons that may have a network of individuals. So for instance, we had a business that had I think close to 24 older adults that don't have access to the computer. We're on the manufacturing floor. So we worked with the liaison at the company to then sign individuals up who may not be getting all of these different communications. So it's a more time-intensive process to identify the ambassadors and liaisons at the different organizations, but that's where we are focused now, just to really reach deeper into the community and make sure that we are connecting with anyone who may be interested. So there's still some work to do, but I am confident that we'll continue to see those numbers go up in the weeks as we continue to work with our community partners to connect with older adults.
Great, thank you. I'm glad to know there's all that outreach going on. It's more than what we see, on a daily basis. So that's very helpful to know. And then my second question is, I think I asked this once before, and I think we know more now. But after I've seen this come up a couple different Nextdoor posts, but after a person's been vaccinated and gotten both their doses, especially like for frontline workers or those coming in close contact with COVID patients, can that vaccinated individual still be contagious and bring it home to their families or to their loved ones or people they come in contact with? Do we know much about how much they can spread COVID?
Yeah, so a great question and very timely, because the CDC just put out guidance today for those individuals that have received both doses of their vaccine, Pfizer or Moderna, or the first dose of the Johnson & Johnson. And again, 2 weeks after you've received your dose is when your vaccine or your immunity is to a point where the CDC is now saying that it's safe, for example, for you to get together with somebody else that's been vaccinated and being indoors. Also, again, low risk situations to have grandparents that are vaccinated, being able to get together with their grandchildren that may not have been vaccinated without masks. And so the good news is to see the guidance that's coming out. The one challenge with that is we just, as they did the clinical trials, the one thing that wasn't clear in the clinical trials is, could you still have asymptomatic spread of the virus after you were vaccinated? So that's, they're collecting that data now to see if that'll happen. And if so, I think that'll provide further guidance on how we address this. Again, the question of, do you have to wear masks after you've been vaccinated and for how long? And we're just waiting for more data to come out from NIH and CDC on that to better give us guidance.
Thank you. And I just had one thought on whether you have to wear masks or not. I'm assuming that we will keep the public mask mandate in place. That would be so hard to know who's been vaccinated and who hasn't. So, oh my gosh. Okay, thank you.
I'm glad you addressed that, Councilmember Anderson, because I do think there's going to be potentially a point in time where the governor's office may no longer have a statewide mask order, and that would be something we would have to revisit as a Board of Health. And we know that my personal opinion and public health recommendation is we know the benefits of masks in mitigating transmission. So as we get more of that data and we see what happens with the governor's executive order, we'll be able to revisit that.
Thank you. That's all my questions.
Great. Mayor Quinn?
So I was just going to ask, Jennifer had mentioned last week that she got in a call with the governor, and I presume you were on that as well, on which he felt that that we'd be back to normal on June 1st. Is that your understanding as well, or was that? I mean, it can't be too confidential a conversation. There were several people in the on the Zoom call.
Sure. That's the million-dollar question. The modeling data from what we're looking at is showing that if things continue as is and we continue to vaccinate our population as quickly as we are, that we'll be back to some sense of normalcy by June. Is that like everybody going out not wearing masks? I don't know if we know that level of detail, but again, being able to resume some of our daily activities, the modeling is showing that we were definitely heading along that trajectory. And so I'm hopeful, given that we're seeing increased supply from the federal government, from what President Biden and the White House task force has developed to increase that supply, that we can vaccinate our community and the state quickly. Yeah. Any other questions? Well, to close out, I would just say we are so close to this point of we've been through this for over a year, and everybody's hung in there. And as we just ended with, if the modeling data is holding true, we're approaching that finish line. And if we can stick in there with the business community and our residents for the next 2 months, I think we're going to be in a much better position. So I appreciate everybody hanging in there with all of the potential fatigue that's out there with all of the COVID restrictions. But I'm coming at this from a place of optimism now, that we're starting to turn that corner and hopefully get us back to a place of a semblance of normal in the summer. So appreciate it, and thank you all. And
Yeah, thank you, staff.
Appreciate you guys too.
Great job, team.
Yeah,
Thanks.
thanks y'all.